Ever heard of Kidney-JOUBERT Syndrome? It's a rare and complex genetic disorder that could leave you spellbound. This mysterious syndrome, often abbreviated as KJBS, is a genetic disorder that affects the brain and kidneys. It's part of a group of conditions known as teleopathies, which impact cells with hair-like structures or cilia. These cilia are incredibly crucial for development and function. Now, KJBS is a bit of a genetic puzzle. It follows an autosomal recessive pattern of inheritance. This means that both parents must pass on a defective gene for their child to develop the syndrome. So, it's not something you catch or develop due to lifestyle factors. It's in your genes from the get-go. And here's the kicker, KJBS doesn't play favorites. It impacts all ethnicities, and there's no significant difference in its occurrence between males and females. So, in essence, Kidney-JOUBERT syndrome is an equal opportunity disorder, impacting all ethnicities without a significant difference between males and females. So how would you know if someone has Kidney-JOUBERT syndrome? Well, the symptoms of this rare disorder typically become apparent in infancy. You may notice hypotonia or weak muscle tone and developmental delays. Some infants with Kidney-JOUBERT syndrome may also exhibit abnormal breathing patterns. One of the defining characteristics of the syndrome is certain brain malformations, which are visible on MRI scans. This is often referred to as the molar tooth sign, due to the unique appearance these malformations present. In terms of kidney involvement, it often presents as nephronophthisis, which is a progressive kidney disease. Now, diagnosing Kidney-JOUBERT syndrome is not a one-step process. It involves a combination of clinical features, family history, genetic testing, and imaging studies like MRI and kidney ultrasound. All these elements together help doctors and medical professionals identify and confirm the presence of this complex condition. Diagnosis of Kidney-JOUBERT syndrome is a multi-step process that requires carefully examining various symptoms and using different diagnostic tools. Imagine living with a condition that has no cure, like Kidney-JOUBERT syndrome. This reality is faced daily by those diagnosed with KJBS. However, it's not all gloom and doom. While a definitive cure is yet to be found, the treatment strategy revolves around managing symptoms and enhancing the quality of life. Think of it as a multi-pronged approach. Physical therapy helps to improve muscle tone and coordination, while respiratory support can alleviate abnormal breathing patterns. Dietary adjustments play a crucial role, especially in maintaining optimal kidney function. And speaking of kidneys, medication becomes a key ally in preserving their health. The long-term prognosis of KJBS is a bit like a jigsaw puzzle. It varies greatly, largely depending on the severity of kidney involvement and other ensuing complications. It may seem like a daunting journey, and indeed, it is a challenging one. Despite the challenges, early diagnosis and management can significantly improve outcomes for individuals with Kidney-JOUBERT syndrome. So, what does the future hold for those with Kidney-JOUBERT syndrome? As we look ahead, the importance of raising awareness about this complex condition cannot be overstated. Greater understanding leads to earlier diagnosis and therefore better management of symptoms and improved quality of life. Ongoing research is another key aspect of the future of Kidney-JOUBERT syndrome. Scientists are tirelessly working to unravel the complexities of this syndrome, aiming to better understand the disorder and develop more effective treatments. This research could potentially lead to a breakthrough that might change the lives of those living with Kidney-JOUBERT syndrome. Improved treatment options are also on the horizon. As we gain more knowledge about the syndrome, we can develop treatments that focus not only on managing symptoms, but also on addressing the root causes. The journey with Kidney-JOUBERT syndrome may be challenging, but with ongoing research and improved awareness, there's hope for a better future. Like, share, comment, and subscribe.